Welcome to our latest episode of the Lebanese Physicians podcast. And today we'll be discussing physician burnout. And our guest is Dr. Alaa Rihan, who is currently a family medicine physician in Tyler, Texas. And prior to that, she was in Lebanon, and she's been involved extensively in physician wellness and physician burnout. And this episode is co-hosted with Dr. MohammadAli Jardaly. Welcome, Alaa, and welcome MohammadAli to the podcast.
Thank you, Khalil. Thank you, Muhammad, for having me today.
So Ala, I just wanted to ask you, like, first tell us a bit more about you, like about your background, your family medicine background, and how you moved to Tyler, Texas.
Sure. So I graduated from the American University of Beirut from the Family Medicine program back in 2015. I practiced there for a few years and I worked as a consultant for like several national and international NGOs there. And I worked in the field of wellness, especially employees' wellness in Beirut. And then I had to move, unfortunately, after the Beirut blast in 2020. I just decided to move to a safer country for my kids. And that's how I ended up in Texas. So I joined the School of Public Health first when I moved UT in Houston, University of Texas in Houston. And I did my master's in public health with a focus on health promotion and health education. And then I decided to pursue another residency, and I am currently a senior also resident in the preventive medicine program at the University of Texas in Tyler. I'm also a diplomate of the American Board of Lifestyle Medicine and a current scholar in the leading Physician Wellbeing (LPW) program through the American Academy of Family Physicians, where we focus on physician well-being and reducing burnout rates in the US. So, in a nutshell, I'm mostly focused on wellness, lifestyle medicine, and prevention to improve health outcomes.
It's great to have you on. Yeah, I identify a lot with your journey. I think as family medicine trained people, yeah, this is our core and our bread and butter. So it's great that you're pursuing more opportunities and representing the department in the US. And I think it's a good segue to talk about burnout because it seems like it's a hot topic and everyone is talking about it. And maybe you can tell us more about uh, how you got involved in burnout.
Yeah, so I personally experienced burnout, and I think many of us are experiencing and experienced it in the past. So whether when I was in Lebanon, like being a mom, a female physician, and then when I moved to the US, and given that my husband stayed in Lebanon, taking care of two kids, having to go to school, uh, during my residency, having to do work at home and at the hospital, all these factors like contributed to burnout, and I became more aware of the problem, and I started reading about it, and then I heard about the program through the AAFP, and I wanted to explore more and learn about it and help other physicians. So I got more involved in the wellness committees in my own institution and through this program, and that's how I ended up here.
Great. So basically, what do you think, like, since you're involved in physician wellness and burnout, so what do you think are like the leading factors for physician
Yeah.
burnout? And I know there's like some charts based on specialties and stuff like that, but so what do you think are some of the leading factors for that?
Sure. Let me maybe just define burnout briefly before we talk about the factors. So it's commonly defined as a workplace related condition, and it's distinguished by three central symptoms. One, exhaustion, two, depersonalization, and three, lack of efficacy. And by exhaustion, like it's marked by a steep decline in physical and emotional energy among physicians. So here, physicians would wonder, like, how much longer can I continue like this? And depersonalization, it's evidenced by growing like sarcasm alongside like an urge to complain about patients or work responsibilities. And it's also referred as compassion fatigue. Lack of efficacy is when the physician starts asking themselves, like, what's the point? My efforts don't really matter. They kind of start to lose their why or sense of purpose. So these are like the main symptoms of burnout. Now, the factors contributing to high burnout are like many factors contribute to burnout, mainly excessive workload and administrative tasks, time constraints and EHR burdens. Like many of us like are struggling with their inbox, right? Like all what we care about is to empty our inbox. The emotional toll of patient care. We don't have to forget that we as clinicians, we deal with a lot of sad stories, right? We deal with the struggles our patients are facing. So that creates an emotional toll on us. And the increased professional isolation. Sometimes, and it depends on the institution that we're working at, we tend to work in silos many times. We found ourselves like lonely, right? So these are the most reported factors, but let us focus also on a very important aspect that many of us tend to ignore, like having a life. Since day one that we entered like medical school, right? We received little to no education on balancing personal well-being during our medical training. And I'm not sure if you guys agree. Did you guys receive training
No,
about having a life?
I went to AUB medical school and we never received training about that. I don't know, MohammadAli, if you have at LAU.
I
No,
went
but
to, yeah, go ahead, MohammadAli, I'm sorry.
not in med school, but in residency, they were kind of aware and they did try to have a wellness program. And we'll get to that later again. A lot of the wellness programs, I feel, frame it as an individual failure when I think it's a systemic issues that require systemic solutions. And a pizza party and a yoga session will not.
Very true. Very true. That's very true. And I also went to BAU, the Beirut Arab University for medical school before AUB, and I did not receive anything about that. So here are like 3 medical schools from Lebanon who do not provide any training for medical students. So, and in fact, residency often continues, like the residency often conditions us to ignore our physical, emotional, and spiritual needs to a problematic degree, and we tend to take these habits into our professional lives later on. So you push yourself until you can't anymore, and then you push further. Anything less might be perceived as a weakness, right?
It's almost like a rite of passage, right? Like you have to become that way to survive. Like med school breaks you over and over and over again, and it's a response. It's a defense mechanism.
Very true. Yeah. And you would be perceived as a weak physician if you complain about it. So there's still like, despite all the awareness about like wellness and burnout among physicians, is still a taboo.
Oh, for sure. And like, I don't want to go off topic, but in my final year project, what I explored was the relationship between the financial burden of going to medical school and burnout, right? No one talks about it. That's another taboo, like how much it costs to like pay for medical school and then how little you get paid as a resident. And then the dream is to be like like a business owner, right? You own your own clinic, but all of us are like employed physicians now. And that loss of like ownership, I think that also contributes to burnout.
Very true. I agree.
So yeah, we talked a lot about like the different causes, and then I mentioned how like a lot of institutions like do like yoga party, like a yoga exercise or a pizza party to come back. So what are your thoughts about the solutions being offered to address burnout?
Yeah. So unless we find like like this systematic cause of burnout, we need to dig into the root cause. Like we need to do some root cause analysis to know what's causing the burnout. And I agree, like even in my institution, whenever we're talking about wellness, people would suggest potluck as a wellness activity. That's not how we address wellness. First, we need assessment, right? We need to assess our employees, the staff, physicians, clinicians, residents, students. We need to know how they are doing and what their needs are. So we need to do a needs assessment, and then we start with like a small PDSA cycles, which is like a quality improvement projects that we can work on small, smart goals in our institutions to achieve better outcomes. And then we assess again through surveys. There are like a bunch of surveys, valid tools to assess physician and staff wellness. Some of which like are the CDC wellness tool, the Stanford wellness tool. There is the Mini-Z survey. There are like a lot of surveys that are valid to assess wellness. And then that's how we either adopt the change that we worked on, or abandon, and then start a PDSA cycle again. And we always and wellness cannot be achieved through like one single person. It has to be a team-based approach. Interdepartmental collaboration is needed here. We need to include like residents, students, staff. It's not enough to just like the program director suggests a wellness activity for the residents. That's not enough. It has to be embedded in the system.
Right. So it has to be embedded in the sense it's basically, I think when we talk about it, it's basically in the US at least, and in other places, it's like medicine is being taken over by like bureaucracies, and doctors feel they don't have control over their own practices anymore. And I think that could contribute to burnout, but then the other parts are overwork, potentially not having a good social life, right? If you don't have a lot of friends or a lot of family support outside of the office, then that also could lead to burnout. And I think, and exercise, these are important things, I think, for people to think about when we're discussing that.
Definitely. So you are focusing on some of the lifestyle medicine pillars, social connection, exercise, and I think we will get to talk more about those.
Right. And so when we talk about burnout, like how much, let's focus on the US right now, because we're all, I mean, I'm in the US, maybe in Saudi Arabia, if MohammadAli has some numbers, but how much is burnout? How many physicians, or what's the percentage of physicians overall that experience burnout?
Sure. So physician burnout here has reached like epidemic levels in the US, exerting like a widespread negative impact on every facet of medical care. So including physician job satisfaction. Globally, like global research across almost all medical and surgical specialties shows that 1 in 3 physicians experiences burnout at any given time, whether like in medical school, residency, or during their career. In the US, the 2023 Medscape Physician Lifestyle Survey highlights an even higher prevalence, with 53% of physicians reporting burnout. And so it was 39.8% in 2013. Now it's 53. So these are really alarming rates.
Right. And I think the important part is, how does that affect productivity and patient care?
So let's agree that like physician burnout is bad on multiple levels, like bad for doctors and their families, bad for staff and patients, and bad for organizations. And burnout is everywhere all the time. So it's really linked to an impressive list of undesirable consequences, whether like it's lower patient satisfaction and care quality, higher medical errors. It's linked to higher medical error rates and malpractice risk due to reduced alertness and emotional exhaustion among physicians. It leads to higher physician and staff turnover. Physicians experiencing burnout may miss work more often and be less engaged. So, and that would affect like their overall, the overall healthcare system productivity. We don't have to forget like physician alcohol and drug abuse and addiction, physician suicide. So burnout, yes, can be a fatal disorder. Suicide rates for both men and women are higher among physicians than the general population and is widely underreported. So unfortunately, although physician burnout is incredibly common and damaging, as I mentioned before, it remains a taboo subject in the workplace.
Right.
And I think there's many factors that make it as such. You mentioned alcohol use and anxiety and other mood disorders. If you report any of those to the boards, you're pretty much asking for trouble, and you're asking for your license to be revoked. So a lot of those systemic changes, right, with the ACGME, when they changed it to the 80-hour workload, they only did that after there was a lawsuit and like people were dying, right? So we're not being proactive in terms of requiring those systemic changes. Khalil was asking about Saudi. There was a study a few years ago on residents, and burnout was like 70%. And it's because of like they don't have any protected vacation time, sick leave time, marriage leave, all of that. So you really need to address like the root causes. Like you need to treat physicians and residents as human beings. Like that's what it comes down to. You cannot treat them as robots. And same when you go into practice as an employed physician, right? If you're practicing factory style medicine, they're measuring your utilization rate and your productivity rate and your RVUs and whatnot. If you're treating them as robots, they're not robots. They're gonna eventually like break. And that's what I tell everyone. Like your iPhone, can you use your iPhone 24 hours? Like at the end of the day, it's gonna become very hot, and you just need to put it aside and charge it. And same with physicians. Like that's what it comes down to, I think.
That's true. And unfortunately, it's not only about the system, it's also about us being proactive towards our own wellness, right? Like we need to be proactive. We don't have to wait for someone to tell us to exercise or eat healthy or sleep. We need also to set our own boundaries.
Right, exactly. There's some personal responsibility in this too. So what is the American Academy of Family Physicians trying to do at this point to combat burnout?
So what they are doing is training these scholars in the field of physician wellness. And what we do over the course of a year is we work on a FIP project, which is a personal health improvement plan, and we work on a SWIP project, which is a system wellness improvement plan. So every physician in their own institution, and they come up with a wellness project with the leadership in their institution and implement it over the course of 1 year, and then evaluate the program at the end. And we share it with all the scholars in the program. We meet 3 times in person, and the rest of the meetings are virtually to discuss any challenges, any opportunities, to learn from each other's in the field of wellness and combating physician burnout. So this is basically what we're doing through the AAFP.
That's amazing that you're sharing experiences with each other. I want to ask you, like, if you're involved or other people involved in burnout are involved in advocacy and with like a lot of efforts of unionizing residents and attendings, how do those two things tie in together in your view?
So I'm like, personally, I'm not involved right now in advocacy.
Okay. But is there a branch in the burnout that's addressing that advocacy? Do they give you the tools to become advocates, or you think like you can do it on like institutional level?
Do you mean in the institutions?
Yeah.
In our institutions? Oh, of course they provide, like I thought like advocating at ACGME or other organizations. No, of course they provide us with the tools to advocate for residents' wellness, students' wellness, and physician and staff wellness at our own institutions, and that's what we are working on.
Great. And what are like the common challenges like you hear from like other people like doing the same work at like other institutions? Is it the same challenges everywhere, or does each place has like a unique challenge?
Honestly, there are common challenges like that
Yeah.
we discussed, like among all the institutions, which are like systematic challenges, heavy patient loads, admin demands, complex insurance requirements, EHR, documentation burdens. So these are like really common
Yeah.
among all physicians. And um, and and now, like I do remember that previously when we did not use EHR, uh, I do remember that we had more face-to-face patient time and more quality time with our patients. This had been reduced since the introduction of EHR. And some also report personal challenges like feeling pressured to be always on, difficulty balancing professional responsibilities with family life and personal passions. And also, there's like the overall cultural expectations in medicine. So you should be the superhero all the time, right? And there's this belief that self-care indicates weakness. Um, so these are like the most common reported challenges among physicians in maintaining wellness in their institutions.
And how do you feel like your expertise in lifestyle medicine helps you address like those burnout and provide like solutions? Like there's a lot of overlap, right?
Oh, definitely. Yeah. So, and there's a growing body of research that indicates that when physicians practice healthy behaviors, they are more likely to recommend those behaviors to their patients, right? So you're improving your own health and you're improving the health outcomes of your patients when you apply this lifestyle. So let me talk briefly about lifestyle medicine. And it mainly focuses on 6 main pillars, which is nutrition, physical activity, stress management, social connection, adequate sleep, and avoidance of risky substances. And when we're talking about risky substances, we're not only talking about smoking and drugs, but also alcohol. So there's no safe alcohol level to be consumed by people. So these are the main pillars of lifestyle medicine. And like we need to be aware of these pillars to be able to implement them in our daily life. Maybe like even very small lifestyle changes, like maybe adding a 5 minute of mindfulness session or a brisk walk during lunch while at work. These small changes have cumulative benefits over time. So having a healthy snack with us all the time instead of going to the vending machine and grabbing like a chocolate bar, right? Who does not do that among physicians? But if we are aware, if we become mindful about our habits, I think it's easier to implement change in our daily lives. So maybe packing some fruits and veggies, maybe also like discussing those options with our leadership. Like don't be passive, always be proactive. Talk to your leadership how you can improve wellness in your department. You can start with like the food that is being provided during your meetings. We can all talk about the type of food that we're being provided, right? We always have pizza, cookies. If we have salads, the dressings that they provide with the salads are really unhealthy. So we can start with very small changes, and that will lead to cumulative benefits with time.
Right. And I can say, I mean, we've all, I think, been through different phases of like burnout through our careers and through our residencies. And I can say that I've reached a point where I do like my exercise with a group in the morning. So that helps me. Then I prioritize my family life, my social life. I do the work that I need to do and enjoy what I do. And I do stuff that I enjoy, like we're doing this podcast right now. Let's say I enjoy it. But I don't anymore. Like I'm reached the point where I don't say yes to everything. They tell me, do you want to be on this and that committee? And I would say, no, I'm not going to be on it. So you need to also, because physicians have this tendency to say yes to everything and work for free for a lot of things that they do. But I think we need to be cognizant of the fact that we have limits, and we only need to do the things that we like to do and not necessarily things that just to please other people.
I totally agree. We tend to be people pleasers. And it's one of the leadership skills to be able to set boundaries and say no when you're supposed to say no, and like just take care of your own health.
Exactly. And so with the family medicine wellness program right now, do you have any results of, has it been successful or is it still a work in progress?
It is the work in progress. So what we're doing now is we're surveying all our faculty and staff. We are assessing their levels of wellness first, but we are also assessing their awareness of the available wellness resources in our institutions. And that's very important because many times we're not aware of what's provided to us. Like we don't know what kind of programs there are in our institution to use, right? So we wanted to assess their awareness of the available resources. We wanted to assess if they are using those resources, and if they are using those resources, are they being helpful? And if not, then based on all of the results, when we get the survey results back, we will start implementing a PDSA cycle, like a quality improvement project. So we always start small, like with a pilot project. We're starting with one department, and if we see that this has been successful, then we will move it to a different department.
Right. And what's your sense? Like, is it gonna be a positive effect?
I feel like so people between each others, they're always complaining about work. So I feel like it's too early to anticipate, but I think that we will not score high on our wellness scorecards, and we will definitely benefit from minimal changes. So what we do also with our residents is we do walk with the doc, like twice per month during lunch break. We walk for an hour. So that could be maybe a policy that could be implemented, and we can ask everybody in the department to join us for that. So depending on our results, we will take it from there.
Right. And so basically, Ala, this was a great episode. Thank you for being with us. And I think we discussed the important topic of physician burnout, what's causing it, how to combat it, and hopefully the work that you're doing with American Academy of Family Physicians will help or be an example of one successful program to combat this very dangerous, actually, I think, to both physicians and patients aspect of medicine. Thank you.
Sure. Thank you, Khalil. And as we mentioned, it's very important. Khalil, are we still on?
Yes.
Yeah.
Yeah. And as we mentioned, it's very important to be proactive towards our own wellness. Don't wait for your institution to start a wellness program for you to start like exercise. Work on your personal health improvement plan, the FIP, and always like start with a broad aim. Like I want to increase my physical activity this year as a New Year's resolution for physicians, let's say. And then create a SMART goal. We all know how like SMART, be specific, measurable, and achievable, relevant, and reasonable time frame. Say I want, like, for example, my FIP for this year, it was like I will spend at least 5 minutes of my morning coffee time every day on mindfulness exercises for 1 month. And then after 1 month, I would reassess how I'm feeling. Did it help? Did it reduce my stress levels? Was I like more productive during the days where I practiced mindfulness? So it's always very important to be proactive and start with our own FIP.
I agree.
No, this was great. And it's sometimes overwhelming to talk about like burnout and the systemic changes. So I think the take-home message for me today after talking to you was it's okay to start small. I mean, and incremental changes will make a difference eventually on the long term.
Like any quality improvement project, always start small and be specific.
Yeah, the only thing I'm going to say before I finish it is the funniest thing for me is when institutions try to combat it by telling you we have a physician wellness, let's say, dinner at 5 p.m., 5 to 7 p.m., and you're like, just want to go home. I don't want to go to a physician wellness thing because that's
That's
not
very
like
common.
wellness. Yeah,
That is very common. Yeah, and that's not how we address wellness and
Yeah.
burnout, unfortunately.
exactly. All right, thank you.
Thank
Thank you.
you. Great meeting you guys.